Ever wondered what some common problems are with T-tubes, J-tubes, and Penrose drains? Welcome to our discussion today. We're taking a deep dive into the world of medical tubes, specifically focusing on T-tubes, J-tubes, and Penrose drains. These small but mighty tools play a massive role in the medical world, aiding in the treatment and recovery of countless patients. However, like all things, they come with their own set of complications and challenges. Understanding these complications is crucial, not only for medical professionals but for patients and caregivers as well. It's about creating an environment of informed care, where everyone involved in the treatment process has a clear understanding of the tools being used. Let's start with a brief introduction to each of these tubes. T-tubes, typically used post-operatively in bile duct surgeries, are designed to provide an external drain for excess bile while the duct heals. J-tubes, or jejunostomy tubes, are used for long-term enteral feeding, bypassing the stomach to deliver nutrition directly to the jejunum. Penrose drains, on the other hand, are simple latex tubes used to drain fluid from a wound or surgical site. Each of these tubes serves a unique purpose and, as such, comes with unique complications. From infection risks and blockages to dislodgement and tube migration, these issues can significantly impact the effectiveness of the treatment and the patient's overall comfort and well-being. But the good news is, with proper knowledge and care, many of these complications can be prevented or effectively managed. This is why we're here today, to bring attention to these challenges and discuss ways to address them. So, whether you're a seasoned medical professional looking to refresh your knowledge, a student eager to learn, or a patient or caregiver seeking to understand more about the treatment process, this discussion is for you. Let's delve into each of these tubes, starting with the T-tube. First on our list is the T-tube. A T-tube is a small, flexible tube that's inserted into the biliary tract, specifically the common bile duct, to help drain bile from the liver into the small intestines. It serves as a crucial tool in the medical field, facilitating the treatment of various conditions like bile duct stones, strictures, and leaks. However, as with all medical interventions, complications can occur. These complications can range from infection to blockage, and even accidental dislodgement. Let's delve into each of these problems in detail. Infections are a common complication with any type of invasive medical device, and T-tubes are no exception. They can occur when bacteria enters the body through the tube site, causing symptoms like fever, pain, and redness. In severe cases, this can lead to systemic infection, which can be life-threatening. So, how do we address this? Well, maintaining strict hygiene standards when handling the T-tube is paramount. This includes regular cleaning of the tube site with antiseptic solution and changing the dressing as advised by the healthcare provider. Next, we have blockage. Blockage of the T-tube is often caused by the accumulation of bile sludge or small stones in the tube. This can cause discomfort, jaundice, or even infection. If a blockage is suspected, it's important to seek immediate medical attention. The blockage might be cleared by flushing the tube with saline solution, or in some cases, the T-tube might need to be replaced. Lastly, let's talk about accidental dislodgement. It is not uncommon for a T-tube to be accidentally pulled out, especially if the patient is active or restless. If this happens, it's important not to panic. Cover the area with a clean dressing and seek immediate medical help. The healthcare provider will assess the situation and decide the next steps, which might include reinserting the tube or opting for a different form of treatment. When we talk about these complications, it's important to remember that they are the exception, not the rule. Most patients with a T-tube experience a significant improvement in their quality of life without encountering these issues. However, being aware of potential complications can help us take proactive measures to prevent them and respond effectively if they do occur. Remember, the key to managing T-tube complications is early detection and prompt intervention. Regular follow-ups with your healthcare provider and understanding how to care for your T-tube at home are crucial steps in ensuring a smooth recovery and optimal health. Stay informed, stay vigilant, and don't hesitate to reach out to your healthcare provider if you have any concerns or questions about your T-tube. Now let's turn our attention to the J-tube. The jejunostomy, or J-tube as it's commonly known, is a feeding tube inserted directly into the small intestine. This is often used when oral feeding is not an option, such as in cases of severe gastroesophageal reflux disease or when the stomach needs complete rest. But as with any medical procedure, there can be complications. One common complication is tube dislodgement. This occurs when the J-tube becomes dislodged from its original position. When this happens, it can lead to leakage or blockage, potentially causing discomfort and malnutrition. To prevent dislodgement, it's crucial to regularly check the tube's position and secure it properly. If dislodgement does happen, medical professionals should be contacted immediately. Infection is another potential complication. As the J-tube provides a direct path into the body, it can act as an entry point for bacteria. Signs of infection can include redness, swelling, or a foul-smelling discharge from the tube site. It's important to maintain strict hygiene practices when handling the tube, and to regularly clean the skin around the tube site. If an infection is suspected, it's vital to seek medical advice promptly. Antibiotics may be needed to tackle the infection. Our third complication to discuss is granulation tissue. This is an overgrowth of tissue around the tube site, which can cause discomfort and bleeding. While granulation tissue can be a sign of healing, excessive growth can cause problems. Treatments for granulation tissue can include topical steroids, silver nitrate, or in some cases, surgical removal. There's also the risk of metabolic complications, which can occur if the patient's nutritional needs are not being met. This could be due to incorrect use of the feeding formula, or if the patient's nutritional needs change over time. Regular monitoring and adjustment of the feeding plan is key to preventing these complications. Lastly, let's touch on psychological complications. Having a J-tube can have a significant impact on a person's mental well-being. They may feel self-conscious about the tube or find it difficult to adapt to the changes in their eating habits. Emotional support and counseling can be beneficial in these cases. In conclusion, while the J-tube is a crucial tool in maintaining nutrition for individuals who cannot feed orally, it's not without its potential complications. Tube dislodgement, infection, granulation tissue, metabolic complications, and psychological issues are all possible problems that can arise. However, with careful monitoring, regular hygiene practices, appropriate medical intervention, and emotional support, these challenges can be effectively managed. With correct care and management, J-tube complications can be effectively handled. Finally, let's talk about Penrose drains. Now, the Penrose drain is a soft, flat, latex tube that is typically used as a temporary drainage device during surgery. Its main purpose? To prevent fluid accumulation and buildup at the surgical site, thereby promoting healing and preventing complications. However, like any medical intervention, the use of a Penrose drain is not without potential problems. Let's take a closer look at these complications and discuss some of the ways we can manage and prevent them. First up is infection. This is a risk with any surgical procedure, but with a Penrose drain in place, there's an open pathway into the body, which can make it easier for bacteria to enter. Signs of infection can include increased pain, redness, swelling, or pus drainage from the site. If you notice any of these signs, contact your healthcare provider immediately. They may need to administer antibiotics, or in some cases, remove the drain. Next, let's talk about skin irritation. This can occur if the skin around the drain becomes red, itchy, or sore. It's usually caused by friction from the drain or a reaction to the dressing materials. To minimize irritation, it's important to keep the area clean and dry and to use a gentle hypoallergenic dressing. If irritation persists, a barrier cream or protective dressing may be needed. Lastly, we have accidental dislodgement. This is when the drain moves or falls out before it's meant to. If you think the drain has moved or if it falls out completely, don't panic. Cover the area with a clean dressing and contact your healthcare provider. They'll be able to advise you on the next steps, which may involve reinserting the drain, or they may decide that it's no longer needed. But it's not all doom and gloom. There are steps that can be taken to mitigate these risks. Regularly inspecting the drain site, keeping it clean and dry, and following your healthcare provider's instructions can all help to prevent complications. And remember, if you're ever in doubt, don't hesitate to reach out to your healthcare team. They're there to help you through your recovery. Despite these potential complications, it's important to remember that Penrose drains play a crucial role in post-operative care. They help to prevent the buildup of fluid, which can lead to complications like abscess formation or wound dehiscence. So while they may seem like a nuisance at times, they are a vital part of the healing process. Despite potential complications, Penrose drains play a crucial role in post-operative care. Managing complications is important, but prevention is even better. When it comes to the use of T-tubes, J-tubes, and Penrose drains, preventing complications begins with understanding the devices and how they function within the body. The more we know about these devices, the better equipped we are to prevent potential issues. Let's delve into some general preventative measures that can be taken to avoid complications with these medical tubes. First off, hygiene cannot be overstated. Cleanliness is absolutely essential when handling these devices. The areas around the tube insertion sites should be kept as clean and dry as possible. Regular cleaning with mild soap and warm water, followed by thorough drying, can help prevent infection. Secondly, careful handling of the devices is crucial. Avoid unnecessary tugging or pulling on the tubes. This can not only cause discomfort, but also lead to dislodgement or damage to the tube. Always handle with care and caution. Monitoring is another significant preventative measure. Regular checks for signs of infection such as redness, swelling, or unusual discharge can help detect complications early. Additionally, any changes in the patient's overall condition, such as fever or pain, should be reported to a healthcare provider promptly. Education is also a key component in preventing complications. Understanding the purpose and function of each device, as well as recognizing potential signs of trouble, can make a world of difference. It's important to educate not just the patient, but also their caregivers. They should know what to look for and what steps to take if a problem arises. Finally, regular follow-ups with healthcare providers are essential. They can assess the patient's condition, ensure the device is functioning properly, and address any concerns or issues that may arise. Remember, these measures are not just for the immediate post-operative period. They should be ongoing practices throughout the duration of the tube's use. Remember, prevention is the first line of defense against these complications. Let's quickly recap what we've learned today. In our journey through the complex world of medical tubes, we've delved into the intricacies of T-tubes, J-tubes, and Penrose drains. Each of these devices, while crucial for patient care, can present its own unique set of complications if not properly managed. We started with T-tubes, those small T-shaped tubes that are indispensable in biliary tract surgeries. However, they're not without their challenges. We discussed how they can sometimes lead to bile leakage or even infection. But remember, these issues can be managed with regular checks, ensuring the tube is secured properly, and maintaining cleanliness. Next, we explored J-tubes, or jejunostomy tubes, which are a lifeline for patients who cannot ingest food orally. But as we learned, they can lead to complications like tube dislodgement, blockage, or infection. Again, prevention is key. Frequent tube checks, ensuring correct placement, and meticulous hygiene practices can go a long way in preventing these complications. Then, we turned our attention to the Penrose drain, a simple yet effective device used post-surgery to prevent fluid accumulation. However, it too can have issues like infection, skin irritation, or even accidental removal. It's vital to remember to clean around the drain site, monitor for signs of infection, and secure the drain to prevent accidental dislodgement. Lastly, we touched upon general preventive measures, emphasizing the importance of regular monitoring, cleanliness, and correct tube placement. By following these simple yet effective steps, we can significantly reduce the likelihood of complications arising from these medical tubes. In conclusion, while the world of medical tubes can seem intimidating, with the right knowledge and tools, it doesn't have to be. Each device, T-tubes, J-tubes, and Penrose drains, has its own challenges, but also their solutions. With proper knowledge and care, we can effectively manage and prevent complications with these medical tubes. Stay informed, stay safe.